Okay, I've got 12 o'clock. I'm going to get us started. Again, thank you for joining us for our May Lunch and Learn. Just a couple of reminders. This is from 12 to 12:30. It is set up in a webinar format, so everybody on this call right now is muted. If you've got questions, feel free to drop them in the webinar chat, and Michelle and I will answer them as they come in. As always, handouts and a recording of this webinar will be made available to everyone that registered, as well as right on the Kinship Navigator website. So again, thank you for joining us. This is our monthly Lunch and Learn series sponsored by the Kin Care Coalition and the Navigator. We've got 30-minute presentations where we give out information that might be useful for people that are working with kinship families. You can take a look at our previous Lunch and Learns right on the Navigator YouTube channel. And our next Lunch and Learn is scheduled for June 20th, and that will be with Empire Justice to talk about the services that they provide for kinship families. My name is Rae Glaser. I'm the director of the New York State Kinship Navigator program. You're probably all very familiar with me. I'm just going to kick us off by giving a couple of minute overview on the Navigator services and how you can access them, and then I will turn it over to our speaker for today. So the New York State Kinship Navigator referral and education for kinship families all across New York State. We provide families with information largely on financial assistance and their legal options, but also things such as educational enrollment, how to obtain official documentation, and linkages to local kinship services, including permanency resource centers, kinship champions, local kinship programs. Our helpline is 877-454-6463. Our website, www.nysnavigator.org. Just a brief snapshot of the things that we provide. We have a helpline 10 to 4, Monday through Friday, where you can call to find out information on kinship services. We will do an intake if you're working, if you're a kinship family or you want to refer a kinship family. And we will make sure that we screen that family for financial resources as well as legal permanency. We provide referrals to case management programs, support groups, legal referrals whenever possible if the family needs it and there's one available. We provide education to professionals across the state in terms of presentations like this one, Lunch and Learn, Kinship 101, Kinship Financial Assistance, Kinship Legal 101. Feel free to reach out. We have an online video archive, and we also co-chair the Kin Care Coalition, where we provide statewide advocacy in terms of budget as well as kinship policy. The third Tuesday of every month, so keep an eye out on our website for the June meeting, which is coming up on June 18th. Just a quick snapshot of our website. Like I said, www.nysnavigator.org. We've got all the information here on what's happening with kinship care in terms of what the Navigator is hosting. We've got a calendar of events across the state, legal fact sheets that you can take a look and see what's available for families, videos, information on kinship policy, a clickable map where you can type in your county and what kind of resource you're looking for. It'll take you right there. Last thing I want to mention in terms of my portion is our permission to contact form, which is available right on our homepage as well. If you are a professional working with kinship families, you want to make a referral, you're not sure what caregiver will actually pick up the phone and call us because they're under an enormous amount of stress. Feel free to fill out that permission to contact slip with the family you're working with, fax it to us, and we will give that caregiver a call so that they don't have to reach out. You can find that right on our website. We return that within 48 hours of being reached with the permission to contact form. If you write urgent, we'll do it within the same day. And that just takes the onus off of the families to reach out to us. We can reach out to them however they find it convenient at the most convenient time for them. Any questions on any of the material I just covered, feel free to reach out. You can call us, hop on our online chat, or email me directly. And without further ado, I'm going to turn it over to our speaker, Michelle Varvaro from the Children's Health Home of Upstate New York. She is the Community and Provider Relations Specialist, and she's going to share information about the services. All right, Michelle, I stopped my share, so you should be good to go, and I can see your screen. Go right ahead.
Thank you. Hi, everybody. Again, I'm Michelle Varvaro, and I work with Children's Health Home of Upstate New York, which is also kind of known as CHHUNY. I'm going to briefly give you guys a background on the services because it's pretty new and this will kind of help you connect why everyone is now eligible. But there have been a lot of changes in the Medicaid world. The services I'm talking about are part of the New York State Medicaid Redesign, which started about 12 years ago. At that time, they did, when they began this whole overhaul, they did have adult care management services in place. And I'm very grateful that they did not add children's for about 5 more years because there was a lot of kinks to be worked out during the transition. But then a couple of years after we started, COVID hit. So this seems like very new information to everybody. What was wrong with the New York State Medicaid system was that we were spending about $50+ billion per year on Medicaid. And a lot of that was going towards taking care of sickness or maintenance. So when they looked closer at this, all these different systems that I have represented here by little buildings, such as mental health services, developmental services, substance and alcohol services, individual doctors and specialists, hospitals, all of these different systems were billing Medicaid directly, which meant they really had no idea who else was working with someone unless it was self-reported, which is difficult for any of us to do. But never mind if you're stressed about what's going on with your child, if English is not your first language, or for adults who may be, have a mental health problem, how are they going to be reporting back and forth? So that really needed to be corrected. Horrible for financial purposes and horrible for treatment purposes. In addition to that, the lack of communication amongst the providers, I am very impressed that they recognized that people needed a lot more guidance and support outside of the doctor appointment or the therapy group or whatever kind of services they were participating in. So that's where care management services come into place. I will take 1 minute to just point out the managed care organizations have taken over most of the Medicaid billing. That is why people used to have cards, insurance cards that said in giant blue and white letters, New York State Medicaid. Now everyone is connected to a managed care organization like Fidelis or MVP or United Healthcare. Their insurance card will look just like everyone else with Fidelis's insurance card, but you'll know they have Medicaid because they will have a code number, which is 2 letters, 5 numbers, and a letter. So I'm going to move on to the care management services. And I do know I'm throwing a lot of information at you guys. I did make an outline that you guys will get after we meet. And my phone number is on the handouts, and you are always welcome to call me. Keep in mind as I'm talking, this is for everyone in New York State who has Medicaid, not just children in these services. So if you know someone who this might apply for, feel free to share the website or my contact information. So Department of Health kind of took over all of these changes in the Medicaid system. And what they did was contract out with things called health homes. That is where I'm from. And I am well aware that it is a very confusing name. We do nothing with home care. We do nothing with housing. So I guess we were meant to have all the needs met under one roof. But what we are is really the link between the Department of Health and all of their rules and regulations and policies and all of the agencies that have contracted out with us to provide these services. These agencies would be much more familiar to you. And this is just a little smattering. My health home covers 55 counties of New York State. I think there's about 10 children's health homes throughout the state. We're large. We cover a humongous area. We have 90 agencies right now under our umbrella, and they cover multiple counties. I do want to point out that we were all working in different worlds. I was always in mental health. Some people may have been doing waiver services with foster care. Some people may have been working with early intervention services. Some people may have been working in hospitals. And one day we all became the same job. I'm only saying that to point out that some of our agencies, maybe the ones who worked with medically fragile, they really will specialize with that population. So when we get a referral like that, we try to connect it with somebody, with one of our agencies that really specializes with that, maybe the nursing care at home, getting medical equipment at home, because they have a level of expertise there. Nothing that you guys have to memorize, just want you to know that it's available. So care managers are responsible for three main things. One, ensuring communication amongst all the different systems and providers. Two, connecting families with services and resources. And three, that follow through of care, really making sure that people, once they have been given instructions or, suggestion from the doctor, that it happens, that they get to the next step. So when I'm talking about communication amongst the systems, I'm going to use some of my own examples. I was supervising a program before working with the health home. And when I'm talking about communication, we're not getting together in circles. We really don't overlap with anybody. We're really meant to kind of tie up all the loose ends, make sure everybody's working together. So a good example of communication might be, one time I was visiting a child at school, and the teacher said, I left a message for mom. I'm really concerned about his morning dosage. He's falling asleep every day at 11 o'clock. So you guys know what this would have looked like. Mom did not work at a job where she had access, to the phone. So she would wait to get the message. And then when she had a chance, leave the teacher a message. And this would go back and forth. Since as the care manager, I'm able to speak with everybody involved. When we enroll someone, we get everybody involved and permission from the parent to speak. I was able to go back to my office, text mom, this is what school said. Do you want me to reach out to the doctor? She responded, yes, please. I reached out to the doctor's office. They were able to adjust the prescription, send it to me, and I got it to school. So communication doesn't always mean conferences and meetings, but that's like a good example of how we're able to help pull together some of the lacks in communication. Another thing I'd like everyone to be aware of is that a way that we help with communication is that when someone enrolls in this program, we enter that child's Medicaid ID into the Department of Health system. Now, other Medicaid providers, if needed, will check on there to see who else is working with that child. The other thing that helps with is that we'll get alerts if that child shows up at the emergency room. So, for example, if I got an alert that someone was in the emergency room, I'd contact the family, find out, was this truly an emergency? What happened? Is everything okay? Is there any follow-up? Was there maybe a prescription to go get x-rays or further testing? And just making sure that they're able to navigate all of that. Maybe they don't know which specialist takes their insurance. This is available at such a preventative level that so many of our families didn't even know that they were eligible for Medicaid transportation, for Medicaid appointments. So just even helping them set that up, but just kind of making sure it happens and we help follow through. We'll also get alerts about annual wellness appointments and dental appointments. And if anyone's on medication that requires blood work, we'll get alerts, and it's not punitive. You're not in trouble if we get an alert. It's really to help make sure that happens. Just make sure that people are staying on top of the wellness appointments, being preventative. And that's about it. It's just really meant to help move things along, not to get anyone in trouble. When I'm talking about connecting families with services and resources, this is going to look different depending on the age of the child, the family situation, what their chronic conditions are. So off the top of my head, I will just spew some of the things that I've helped families do. Apply for disability for their children, fill out Section 8 applications and SNAP benefit applications, learning how to use Medicaid transportation, a lot of finding specialists or therapists or psychiatrists, A lot of times schools were asking us to help connect with a neurological assessment. This section right here where it says preventative services and chronic disease management, that would be like maybe if somebody had diabetes or sickle cell disease, connecting, making sure that they're maybe connected with somebody, and this is if needed, where they could help them be more preventative about maybe their diet or, taking care of their diabetes by eating correctly. So it might be a class, it might be a dietitian, whatever is needed. We work with up to age 21. So a lot of maybe helping some kids get ready for the transition out of high school, maybe some summer work programs. It's just really broad, but we have done a lot of everything. And then finally, the follow through with care. I think I used a few examples and I think everyone's getting it, but if there's any questions, please pop them in the box so that I can answer. And then I'm going to move on to who's eligible. But to do this, I'm going to switch over to the website because there's a few things I want you to see there. So our website is childrenshealthhome.com. It's very easy to navigate. You could even change the language of the entire website. I'm going to start off. This is the main page, and I'm just scrolling down a little to click here. I'm going to show you a video that is less than 2 minutes long, but I think this is a really good tool to use if you're trying to explain to someone what the services are, because the only thing we really looked like was maybe like a DSS service because we come to the home. And I just want people to know this is not for anyone who's not doing what they have to do. This is available for someone who may have 1 or 2 kids and then one of them has a new diagnosis, and when should they stop working and start researching it and know what to do. It's somebody to help them navigate everything. So let me play this for you guys. What happened? Why is it not popping up now?
All the best technology plans,
Oh,
right?
here it goes.
This
like we
works
just
for this
practiced.
one.
Today is the perfect time to ask about any concerns you might have regarding your child. Are you feeling overwhelmed with your child's frequent appointments, or would you like to learn about other services or resources that could help your family? It's important to know that you are not alone and support is available. Like many New York families, you have a lot going on. A care manager may be available to support your family. A care manager is part of a Medicaid program called Health Home. Health Home is a network of providers that work together to assist children who have many needs to help them stay healthy in their homes and communities. The provider network is led by the care manager. A care manager will help with communication and coordination with each family's network. If your child has Medicaid and meets the eligibility criteria, you will be paired with a care manager at no cost to you. A care manager is dedicated to advocating for your child and your family in working with all your child's service providers and supporting you in decision making. Your care manager works with a team of people in your home and out in the community to increase your child's access to services that meet your family's goals. Your care manager will work with you to manage appointments and link you to doctors, peer advocates, treatment, housing-related support, resources to access food, transportation to appointments, school-related services, and other community programs. It means better care for your child and for your family, greater access to services and programs for added support, all with a team of people behind you. So, start the conversation. Ask your service provider today if you qualify to join a health home and be paired with a care manager. The support New York families need is available through Health Home Care Management. Together, we'll make sure you get that support.
All right, so that is always available on our website. And that was the main page. Scroll down a little and clicked there for the video. And I'm now clicking learn more to show you who is eligible, which is basically everyone with a need. So when I am talking about chronic conditions, you are eligible for this program between 0 and 21 years old with Medicaid. Just keep in mind, not Child Health Plus, but Medicaid. And again, you'll know it's Medicaid because the ID number will be 2 letters, 5 numbers, and a letter. And then meet criteria by having 1 or 2 chronic conditions. A chronic condition is something that lasts a couple of months or longer. And if you don't take care of it, it gets worse. So I am going to open up the list of chronic conditions, and you will be getting this after the meeting. And I was kind enough to minus out Department of Health's excessive wordiness here and just send you the list, which is here. And besides this being in alphabetical order, the first thing you may notice is that this is a complete blend of all those different systems I showed you to begin with. I will also point out that something like Alzheimer's is on here because they use the same list for both adults and children. But all of this, the things on this list, which is probably about 6 pages long, are all chronic conditions. So there are things like related to alcohol here. There is asthma, which is medical. There's bipolar, which would be a mental health diagnosis. ADD was on here, which is more behavioral. This goes on and on, but again, it's a complete blend of those different systems I showed earlier. So any 2 things on this list would help somebody qualify for our services. Just pointing out chronic, chronic, chronic. We're not listing every single diagnosis in the world. I had a little girl referred to me when the school had the eye screenings. The eye doctor noticed that she had something wrong. Turns out she was losing sight in one eye. I do not remember the formal name of that diagnosis, but I qualified her under a chronic eye diagnosis, and her second chronic condition was a speech delay, which leads me to developmental. So again, you guys will all get these lists and you could look through it. You could also call me when you're trying to, see who is eligible. Under developmental, once someone is classified OPWDD, they'll put them in a separate health home called a CCO. And the only reason for that is that it's lifelong services. But kids are eligible for our services, and we will help families get to the point of qualifying them if they're going to need it. When I do presentations with OPWDD, which would be kids who maybe have delays or will probably, not live on their own in the future. So they may be developmentally delayed or have some sort of delay, where they get this OPWDD certification, and then OPWDD assists with housing and programs and things like that. That's just if some people are not aware. I would say when I was running a program, at least 35% of the kids were going to someday be OPWDD eligible, certified, but we're able to work with them in the meantime. I think rule of thumb is, from what they were saying in the presentation, they were suggesting maybe 14 years old to start that whole certification process. So to get back to my services, developmental language disorder, for the most part, it's a speech delay. I have not seen it be anything but that. But under developmental delay, it could be a learning delay. It could be autism. It could be cerebral palsy. So there's a whole list of different things, and that's going to be included in the list that you get. And then this list goes on and on and on. And any 2 things on that list would help someone qualify. The other thing is that you can qualify with 1 chronic condition, and it would be one of these 4 categories. So HIV and sickle cell disease are more self-explanatory. You have the diagnosis or you don't. SED means that you have a mental health diagnosis that's at the point of impairing your daily functioning. That's going to require a lot of paperwork and So maybe if somebody has depression and they're refusing to go to school or something like that. So I know that we don't have much time. If that's going to be something that someone wants to qualify someone with, you can give me a call and I could go through the whole process with you. We do need to have someone with a license sign off on the fact that they're qualifying under SED. The other thing I want to point out is that you saw bipolar was on that list. So is depression and various other mental health diagnoses, meaning if they have another diagnosis, it's much easier to enroll them. We don't need all the extra paperwork. Complex trauma is the greatest thing that they have ever done, because complex trauma is saying that the child does not have a diagnosis, but they've experienced some sort of trauma and they could benefit from getting connected to our services. Things that would qualify a child here would be change in caregiver. Maybe they had death of a parent or a parent who's incarcerated, having a parent with a mental health or a substance abuse disorder, having being a victim of any type of abuse, witnessing domestic violence, bullying was even on the screening tool. All of these situations are clearly traumatic and it would affect a child even though they don't have a diagnosis. So we do have a packet that would need to be filled out by anyone with a license, licensed social worker, psychologists, pediatrician, psychiatrist or therapist. So again, my phone number will be on the handouts and I'm happy to walk you through that if that is how you need to qualify a child. And the final thing I want to go over is how to refer. All you do is click this button. You can punch all the information right into the computer. And I'm not sure, this is moving a little slow. Here we go. So you can actually punch all of the information directly into the computer, which seems to be down right now, sorry. Or there it goes. So that's where you punch it in. The other thing I will just show you for clarity is you can print this out and send it in. And the fax number and the email are right there. And just highlighted in yellow is the things that we must have to move forward. We don't need a parent's signature here, but whoever is making the referral is implying that the parent or the guardian gave them permission by clicking the box, and here's their contact information. If the child's 18 or older, they'll consent for themselves. Here's the person making the referrals information and how are they eligible? Is it 2 chronic conditions? Click the box and write what they are. At this point, we don't need proof at this point, but when the care manager gets permission from the parent, they're going to reach out looking for proof of the chronic conditions. Or is it one of the categories that I just reviewed where it's just one chronic condition? So I know I'm breezing through this because I want to make sure I fit everything in. I also wanted to just point out that what the service looks like. The care managers meet families in their homes, at schools. If they want to meet at Dunkin' Donuts rather than the house, that's fine. But no one has to come to our office. It's really meant to be something that is helping families navigate all the different systems of care, know what they're eligible for, communicate with other staff, maybe the school or doctors. And what it would look like is we have to see, in most cases, except for very low cases, we have to see the child at least once a month face to face. And obviously there's going to be additional work communicating with maybe the school or the parent or the doctor as well. So I saw there was a question here. We can work with people as long as they're working with us. So it's not like only a 6-month program or a 1-year program. I think every 6 months, the care managers will set goals with the family. If they're still working on the goal or they met the goal and they want to move towards something else, we'll continue working with them. if we keep checking in and they can't see us or everything is okay, at some point we're going to wrap it up. But there is not a limit. People could stay with us for years, and children do age out at 21. Any other questions? Can a child be enrolled in both OPWDD services and Children's Health Home? No, they cannot, because it's, well, I'll tell you the loophole here, because as I said earlier, children can qualify for our services with various delays. And if they have the Medicaid already, we can enroll them and work with the family until they're ready to get OPWDD certification. What has happened in the past is that once they were OPWDD eligible, then the CCO, which is a separate health home for just OPWDD, would take over. It has gotten to the point where if we were working with the family and there's a good relationship, the family is able to stay with us until the child turns 21. Oh, thank you, Deborah. So if anybody wants to, you know what? I know it's getting late, but one thing I want to show you on our website, because
Michelle, we do have bandwidth, so don't worry about running over. You know,
oh,
anybody
okay,
that's on the call, feel free to stay on the call. Some of these are really tough to fit in with a half an hour, so feel free if people have questions, if you want to show some more, go right ahead.
sure. I know everyone here is from different counties, so I'm going to show you. This bar is on the top of every page of our website, but I'm clicking on our provider network and clicking on care management agencies. And this, I mean, if someone wants to give me an idea, maybe I will pick Albany. This will show you the agencies that are in your area. You have the ability to pick one or just take whoever has an opening. When you do make a referral, you should hear back within a day or two that your application has been received and who's taking your, who has been assigned the case. So then you should expect to get connected with for the care manager to reach out to you. And then what happens? So this is just an idea, which we have plenty of agencies in each county. Some, some counties are more full than others. If anyone had a certain county that they wanted me to show, I will. But again, everyone can log on here. Anyone have any other questions? Was everyone able to see my screen? I just realized I was probably looking at it myself.
I can see it. I'm the only one that can talk, but if I can see it, everybody else can too.
Okay, so
And I think the
saw,
important thing too is your contact information will be in the slides as well, Michelle. So if folks have questions, are they able to reach out to you directly?
yes.
Okay. It actually does look like maybe we had some screen sharing at the end, but I know that you are going to be providing those links. Everybody will have access to be able to see it. So,
Yeah.
you know, if anybody's got any lingering questions, feel free to drop them in the chat. And then what we can do is we can have you follow up one-on-one with Michelle if you have ongoing questions.
Yeah. Someone just asked for Putnam. So this is something else. If you notice, this is the all the different counties that different agencies cover. And that's when these changes happened, it kind of knocked down the walls of just this county, just this county. There's a lot more meshing between counties now. And a lot, since the whole world knows how to use Zoom, a lot of our agencies are hiring maybe remote staff or partially remote staff. So it's kind of nice. And if anyone is interested, almost all of our agencies are hiring because as people learn about the services and they fill up, they need to hire more staff. Is there any other questions that I did not see? Oh, sorry. Did you guys see? I hope you saw when I shared Putnam.
Yeah, I can see the screen.
Okay.
I think that there was just an issue in the interim, but we are good. Well, Michelle, thank you so much for joining us today. I think this was really informative. We see from the chat that people have got questions, they're interested. I encourage people, we will send out the information. The recording and the slides from today will be sent out within the week to everybody that registered. And if you've got questions, feel free to follow up Michelle one-on-one.
Thank
So
you. So
thank
keep in
you.
mind, this is good. This is a good service for maybe somebody who doesn't have too many needs to just have care management. But if they have multiple staff involved, we work with that other staff. So even if we're talking about a 10-year-old, there is probably, if they're getting referred to us, multiple school staff involved, a pediatrician, maybe a therapist, if DSS has any involvement. So there's a lot of different parties involved. So I really like this after working in the mental health world for years. Everything seems so cookie cutter. This is really going to look different depending on every child, every family. So I am very happy to be promoting this program.
Absolutely. I think it'll be really useful for the families that we're working with. So thank you very much. And Joanne, I identify lots of information, too little time. We always try to do these as half an hour snapshots so that everybody can join us. Sometimes I think they should be extended to an hour, and this would have been one of them. So thanks for bearing with us, sharing all the information that you did today, Michelle. Really happy to have you, and we will follow up with questions that we have them.
All right. Thanks so much, everybody. And feel
Have a
free
great
to
day.
contact me.